Now I'm going to show you how to actually mix insulin. Now this is just an example. Always follow your hospital protocols, your doctor's orders, because procedures and medications do change over time. Okay, the very first thing you want to do is you want to check your physician's order to confirm how much insulin you're actually giving. And our doctor's order says administer 10 units of Humulin R and then 12 units of Humulin N sub-Q before breakfast daily. After you confirm that, you want to make sure you have the right medications. So you're going to take your vial and you're going to look and read what's on the vial. Here we have Humulin R, and you can tell because it's a clear solution. And then we have our other vial, which is Humulin N, and you can tell because it is cloudy. And you need to ask yourself, how many total units of insulin am I going to be giving? 10 units of Humulin R and 12 units of Humulin N. So that equals 22 units total. Then you want to make sure you know the peak times, be familiar with the peak times of each of these insulins. I have a video of mnemonics that can help you remember the peak times of this. A card should be popping up and you can access that. So let's go over it real fast. The peak of Humulin R is 2 hours and the peak of Humulin N is 8 hours, and this is when the patient is at most risk for hypoglycemia. NCLEX likes to ask about that, so make sure you know that. Then next, what we're going to do is we're going to perform hand hygiene, clean our hands, and we're going to put on some gloves. Then after we put on our gloves, we are going to take our cloudy insulin, because this is a cloudy solution. It's their NPH, the intermediate insulin, and we need to mix these ingredients because they like to settle. So to do that, what you're going to do is you're just going to roll the insulin gently in between the palms of your hands and just roll it and get it mixed up, because if you don't do this, it'll alter how much NPH you're actually drawing up. So you want to make sure the solution is good mixed, and never shake it because that causes air bubbles and that can throw off how much NPH you will actually draw up. Okay, next what we're going to do is we're going to take our alcohol prep and we are going to clean the tops of these vials to make sure we're getting rid of germs. So we're just going to clean for about 5 to 10 seconds, really good, each vial. And then we're going to go to the next vial and just clean that. And now we are ready to use our syringe. So what we're going to do is you're going to take the cap off of your syringe, and we are going, remember the mnemonic RN, we're going to start with regular insulin and then go to cloudy. So it's going to go clear to cloudy, regular to NPH. So we are going to inject 12 units of air in our Humulin N insulin. So just pull back on your syringe to 12 units, which is there. We're going to inject the 12 units of air into the vial. Then we're going to remove our syringe and we're going to inject 10 units of air into the Humulin R. So we're going to pull back on the plunger to 10 units and we're going to do the same thing, but we're not going to remove our syringe. Instead, we're going to take the bottle and flip it upside down, and we are going to remove 10 units of regular insulin. And you watch on your syringe where 10 units is and make sure it's precise. And once you have that 10 units, you're going to remove the vial. And then we're going to go to our Humulin N because that was the clear. Now we're going to cloudy. And we're going to remove a total of 22 units for the whole total dose. So we're going to go into our NPH and we're going to remove a total of 22 units. And that will equal how much we're to give.